Dr. Weinfeld, what is a secondary facelift?
Okay, a secondary facelift just means the second facelift. What that means is that someone's had a facelift in the past, usually a while ago. Over time, they've developed some of the features that make them feel as if they look older than they would like to look, and so they seek a secondary facelift. And as with all or almost all facelifts, there's going to be some component of a neck lift, almost always. And then again, if there was someone seeking a secondary neck lift, then they're also most likely going to have some element of a secondary facelift done as well.
How long after someone's first facelift do they usually seek a second facelift?
There are a lot of different studies that talk about how long a facelift lasts. Some show as short a period as 7 years, and then some show as long as a period as even 15 years. Now, I think 7 years, especially for the techniques that I'm using, is kind of on the low side. So really, what we're looking at is somewhere between 7 and 15 years plus. So I would say that the majority of patients are seeking a secondary facelift somewhere in that time frame, 10 years, up to 15 years, and it's not something that has to be done. So clearly we're having patients come in 20 and 30 years after their facelift to seek a secondary facelift as well.
What's the difference between a secondary facelift and a revision facelift?
Okay, that's an important distinction. A secondary facelift, in my definition, is going to be a facelift for someone who had a facelift quite some time ago, and they were generally happy with the facelift and the neck lift component of it. But over time, over a fair amount of time, they've developed some features again that look older than they would like, and they're seeking a facelift. A revision facelift is a facelift for someone who had a facelift, and it may be a shorter period of time ago, a year, 2 years, 3 years ago, and they just never felt like they got what they wanted from that facelift, and they're seeking a revision. It's kind of like a revision rhinoplasty is a rhinoplasty to change to improve upon a rhinoplasty that someone had, and they don't actually like the outcome. So that's the difference. Secondary facelift is a facelift for someone who's developed more signs of aging over a long period of time after the first facelift. Revision facelift is to change, to improve upon, to correct, if you will, some of the features that the patients didn't like and never liked about the facelift that they previously had.
Dr. Weinfeld, what's pricing like for a secondary facelift?
Okay, so the pricing for a secondary facelift is basically the same as the pricing for a primary facelift, for a primary neck lift. And we're real transparent with our numbers before you come in for a consultation after a little bit of a discussion with our patient care coordinators, trying to gather information about what it is you're looking for. We will be able to give you a price range. But at the root of the question is, does it cost more or does it cost less to do a secondary facelift? And the answer is no, because generally it's the same amount of work, it's just slightly different work.
When someone's had a facelift already, they're going to have scars. How are they handled during a secondary facelift?
Okay, so let's think about two different categories of scars, because yes, prior facelift, prior neck lift, there's going to be scars. Let's say those scars are optimal. Let's say those scars are basically where I would place the incisions for my own facelift. Meaning the facelift that I'm performing on a patient. So in a secondary facelift, I essentially use the facelift, the neck lift scars that already exist. Now, in some patients who've had a prior facelift, those scars might not be in optimal locations. They may be having characteristics that make them more noticeable because they're not hidden in the contours that we usually hide the scars in, or because over time they've stretched or they've developed some sort of characteristic that draws more attention. When that's the case, a secondary facelift, a secondary neck lift is a wonderful operation to restore some of the youth, a lot of the youth to the face and to the neck, but also to remove the bad scars, replace them with good scars, and replace them in locations where they are more difficult to see than they previously were. So in a secondary facelift, you also get improvements in your scars almost always.
What other procedures are usually done with a secondary facelift?
Okay, first and foremost, fat grafting, top of the list when we're thinking about other adjunctive procedures that are done with a secondary face and neck lift. Almost all patients, even if they've had a primary facelift with fat grafting, are going to have some loss of fat over time. Adding volume in really key, really important areas such as the cheeks, temples, can really help turn back the clock in terms of their facial appearance, and so that's going to add to the results of a secondary facelift. Now, many patients who've had a primary facelift will have already had upper and lower lid blepharoplasties. So if they have had these procedures, we usually don't address them again, certainly not as aggressively as they may have done in the past, because the last thing we want to avoid is creating a situation in which a patient has difficulty closing their eyes. Now, lip lifts, if a patient, especially a female patient, has had a prior facelift and has not had a lip lift can be a really important central facial procedure to really restore a youthful contour to the lip when we're looking at the patient from the front and from the side, creating a beautiful little slope to the lip, some eversion of that white roll of the vermilion. Then there's all the sort of facial skeletal procedures that may be important, things that help increase femininity in a female face, such as perhaps reducing chin projection or even increasing chin projection when necessary, whether it be with an implant or making a cut in the bone and repositioning the chin bone. We can also, if we don't think that fat grafting is going to provide enough facial volume, bony volume to the malar, to the cheek region, very well-designed cheek implants that add just a little layer of support to the bone can be very helpful. Brow lifts, really important. Two types usually. We've got a direct brow lift, subcutaneous incision made in the hair, really treats the brow itself. And then there's the endoscopic brow lift, which really should be thought of as the upper third facelift because it allows you to lift the brows, but also lift and support the temple tissue, complementing the face and the neck lift. So those are the procedures. The one that we have to exercise a lot of caution with, and I'm going to address this actually in a next segment, is the blepharoplasties, because if they've been done before, we really want to avoid exacerbating any lid closure issues.
Dr. Weinfeld, tell me about lid closure and secondary facelifts.
Okay, that's an oddly specific question. You're talking about lid closure, L-I-D, lid, the eyelids. Okay, so when we're dealing with a population of patients who had a prior facelift, many of them have had upper and lower lid blepharoplasties. Sometimes those patients have had lower lid blepharoplasties that are a little bit more on the aggressive side, and they actually have difficulty closing their eyes, or they have lid retraction, giving them sort of a puppy dog, tired kind of appearance. So there's good news for those patients, right? There's really good news because the modern deep plane facelift that is performed even as a secondary facelift really elevates and supports the cheeks. And by supporting the cheek, it supports the lower eyelid, and that can help with the abnormal anatomy, the excessive scleral show, and then the inability to close the eyelids, especially at night, leading to dry eyes when you wake in the morning. So there's a lot of great news for patients who are going to undergo a secondary facelift. If they're having difficulty closing their eyes from a prior lower lid blepharoplasty, you may get a lot of improvement in that problem.
Okay. What is recovery like for a secondary facelift?
Okay, so recovery and a secondary facelift. It's not that different than from a primary facelift. Discomfort, aka pain, usually not a lot of pain. Some patients do report if they've already had a situation where from their primary facelift they have a little bit unusual discomfort or pressure, pain around the ears, that it can be temporarily exacerbated, worsened. But generally, again, facelifts don't have a lot of discomfort. Usually patients take 1 to 2 narcotic pain medications. And so, that's one element of recovery. Second element of recovery, bruising and swelling, usually maximizes at 3 days and then dissipates after that. We do a lot of things to help reduce that bruising and swelling, help it heal, help it accelerate in going away. How long are you going to look like you had the facelift, the neck lift? Well, basically the same as a primary facelift. It really kind of depends on sort of how you feel about yourself and whether you're self-conscious, knowing that there may be some elements of your facial appearance, your neck appearance that are visible. Some patients really feel very comfortable going out at 7 days. Some patients, it can take them a full 14 days before they feel like going out. Strenuous physical exercise, usually that 2 to 3 week time frame, a little bit closer to that 3 week time frame. And then if anyone does contact sports, we're going to ask you to hold off for a period of 2 months. Now, if you've got a big event and you want the most natural photos,
that you can get, I would wait for at least 2 months after that face and neck lift. So the majority of the swelling has gone away. So everything's looking nice and smooth and sleek. You're getting all the benefits, really maximized benefits, but there's no telltale signs of surgery at that time frame.